Hi, I'm Dr. Keith Ryan, chiropractor in Tulsa, Oklahoma. I wanted to talk to you about hip pain. Now, when I'm talking about hip pain, I'm actually talking about where your femoral head sticks into your hip. The actual part that holds your body up when you walk, the part at the end that fits into your pelvis that articulates when you walk. And the reason why I say that is because lots of people call hips different things. A lot of times people call their whole pelvis their hips, or they call their sacroiliac joints, which are kind of more on the back here and articulate part of your pelvis, your hips. So I just wanted to be precise on, I'm actually talking about where your femur, the little ball on it, articulates into they call it the acetabulum, the socket, but it's actually where the ball goes into the socket and works on your hip. Now, what the heck could go wrong with that? You think it's in the socket, if it's not worn and has some wear and tear, that there might not be a problem with it. But in fact, there can be a lot of problems with your hip. They get caught up all the time, and so that when people come in and all of a sudden I do the check to see if their hip won't move hardly at all, and I adjust that hip, and all of a sudden they have free range of motion in their hip. A lot of people think that their hamstrings are just tight. I can't really move my leg up because my hamstrings are tight. But in actuality, it's that their hip is locked up, and you release that hip, and all of a sudden they have so much more flexibility in their hips. Now, what's the kind of thing that goes on when you have a hip out of place? I see a lot of hips out in high school runners. And that's because they don't really do track and field year round. They do other sports, and all of a sudden they're intense track and field, and it makes their hips go out. Also happens with other runners, especially when they start stepping up a level, that their hips go out. So you can have a problem with your hip, usually totally fixable, and we correct it with an adjustment, and then you go on your way. Now, the long-term ramifications of having a hip that's fixed and not corrected is you're going to start to develop arthritic problems and degeneration inside on your hip and the joint that it fits into. The acetabulum, the part that the ball of the hip fits into, and then they wear out those. And if you do years and years, and then you need a hip transplant and moving that. So a lot better just to keep your hips moving well and functioning. I mean, especially if you're doing athletic sport, it just makes a lot more functional approach to you doing your exercise well. Hope this helped with some good information. Thanks.